Corona-related situation update worldwide, especially in Europe. Coronavirus fight in Scandinavia. The country has drawn global attention with an unorthodox approach while its neighbors have imposed extensive restrictions. When the coronavirus swept into the Scandinavian countries, Norway and Denmark scrambled to place extensive restrictions on their borders to stem the outbreak. Sweden, their neighbor, took a decidedly different path. While Denmark and Norway closed their borders, restaurants and ski slopes and told all students to stay home this month, Sweden shut only its high schools and colleges, kept its preschools, grade schools, pubs, restaurants, and borders open, and put no limits on the slopes. In fact, Sweden has stayed open for business while other nations beyond Scandinavia have attacked the outbreak with various measures ambitious in their scope and reach. Sweden's approach has raised questions about whether it's gambling with a disease, COVID-19, that has no cure or vaccine, or if its tactic will be seen as a savvy strategy to fight a scourge that has laid waste to millions of jobs and prompted global lockdowns unprecedented in peacetime. By Saturday, Norway, population 5.3 million, had more than 3,770 coronavirus cases and 19 deaths. Denmark, population 5.6 million, reported 2,200 cases and 52 deaths. Sweden, with 10.12 million people, recorded more than 3,060 cases and 105 deaths. There is no evidence that Swedes are underplaying the enormity of the disease rampaging across the globe. The country's leader and health officials have stressed hand washing, social distancing and protecting people over the age of 70 by limiting contact with them. But peer into any cafe in the capital, Stockholm, and groups of 2 or more people can be seen casually dining and enjoying cappuccinos. Playgrounds are full of running, screaming children. Restaurants, gyms, malls, and ski slopes have thinned out but are still in use. Sweden's approach appeals to the public's self-restraint and sense of responsibility. The whole system for communicable disease control is based on voluntary action. The immunization system is completely voluntary and there is 98% coverage. Sweden's method flies in the face of most other nations' stricter strategies. India is attempting a lockdown that affects 1.3 billion people. Germany has banned crowds of 2 or more people, except for families. In France, residents are asked to fill in a form stating the purpose of each errand when they leave their homes. Each trip requires a new form. Britain has deployed police officers to remind residents to stay home. Still, while Sweden may appear to be an outlier in Scandinavia and in much of the wider world, it is too soon to say whether its approach will yield the same results as other countries. And the Swedish authorities could still take stronger action as coronavirus hospitalizations rise. The coronavirus crisis has brought Europe's failings into sharp relief. Europe is being ravaged by the coronavirus pandemic. There have been more than 10,000 deaths in Italy. In the grimmest of league tables, Spain comes second. Normal life has been suspended across the continent and the hit to the economy is immense. France's output is running at 2/3 of what it was last year. Germany has abandoned fiscal rectitude and, along with the rest, adopted a whatever-it-takes approach. Border controls have been erected to stop the flow of people even though this contravenes one of the founding principles of the single market. Rules on state aid to struggling companies have been relaxed. The European Central Bank has embarked on a gigantic asset purchase scheme in an attempt to flood the Eurozone economy with cheap money. If ever there was a time for Europe to act as one, for the richer countries to show solidarity with those less fortunate, then this is it. Yet when Italy pleaded for fellow countries to send it medical equipment such as masks, France and Germany not only failed to respond, they placed export bans, since lifted, on the export of the kit Italian hospitals were crying out for. In the end, it was left to China to show Europe how to respond to a country in dire need. Another problem for Italy is that because of its slow growth and high levels of public debt it has to pay a higher rate of interest on the money the government borrows than is the case for Germany. And when the hospitals in the cities of Lombardy started to fill up with COVID-19 cases, The crisis has highlighted the weaknesses of the Eurozone, the lack of coordination between monetary policy run by the ECB from Frankfurt and fiscal policy under the control of member states, the lack of a sizable, single budget, the absence of financial tools that would make a collective approach easier.